Okay, we'll be continuing with the doubt solving. तो हमने क्या किया था? ये वाला तो क्वेश्चन वाज centroid question था. Edges in front of the centroid normally. ये triangle ने क्या क्या किया था? There were 4 things that he did and we had to arrange it in order, है ना? Yeah. So he was the first. He first did fund the he funded American orthodontic का कुछ तो book था. Then he did the pin and tube. Then he did the ribbon arch. What's happening? Pin and tube, then arch, then the whole appliance. He did. Now, um, now, now I'll be going through the questions. Okay, so lower lip line in normal patient basically. Lower lip line, upper lip line होता है. This is the lip of a patient. Lower lip line ये है. तो where it should be incisal third. जो दांत होते हैं उसके मिडिल थर्ड सर्वाइकल थर्ड तो इंसाइजल थर्ड पे लाई करने चाहिए लोअर लिप लाइन. ये बोलना चाहते हैं ये. Now lisping lisp is actually associated with anterior open bite. उसमें ऐसे साउंड आता है ऐसे साउंड आता है तो that is known as lisping. Now what is binder syndrome? Binder syndrome, this we have to know. What is binder syndrome? It is actually maxillo-nasal, which is the middle third part of our face. उसका dysplasia. Maxillo-nasal dysplasia. हम उसको binder syndrome बोलते हैं. It's actually another name for maxillo-nasal dysplasia and bracket में binder syndrome बोलते हैं. It's an uncommon congenital hair condition and it actually characterized by retruded midface. जो midface होता है that is only retruded. तो ऐसे this is the midface, this is retruded, this is the nose, this is the lips, these are the eyes, this is only retruded. A flat nose हो जाती है obviously and it's a congenital malformation, ये तो पता ही है. Nasomaxillary जो hypoplasia होता है that's due to underdevelopment of the midface skeleton. जो midface जो skeleton होता है उसका underdevelopment होता है. It's not because of the overdevelopment of the mandible, it's because of the underdevelopment of midface. So binder syndrome is that, and it is because of the disturbance of the prosencephalic induction center during embryogenic life. तो prosencephalic induction center. That is disturbed during embryogenic formation, and the birth trauma has also been because of the trauma. अगर birth में trauma हुआ, birth trauma तब भी हो सकता है. And there's obviously class 3 tendency because mandible आगे आ रहा है तो binder syndrome में dysplasia होता है तो class 3 दिखेगा. Now, Dockrell, Dockrell, we need to know what Dockrell equation is. Dockrell equation. Okay, so it's assessing the timing and site of act of the etiological factors of malocclusion. It is actually assessing timing and site of act of etiological etiological agent of malocclusion. So that is Dockrell equation. Okay, to it is also known as Moyer's equation or Moyer's classification. So जो Moyer's classification होता है ना, that is based on the Dockrell equation जो Dockrell ने दिया था, and it is a brief expression of development of any and all dentafacial deformity. Certain original causes act for a time at the site and produce a result. तो उसके लिए हम कहते हैं तो there are two important things, time and the site. These two things, they're important. Anything else? Like इसमें options में दिया हुआ है amount of transfers, skeletal discrepancy, sagittal, space and all, space in the arch and all. सब बकवास है. But we have to assess the timing and site of the action of the etiological agent. That is Dockrell equation. It is used in this. तो timing and site find out करने के लिए हम Dockrell equation use करते हैं. The result of muscle forces acting through the intercuspation of the occlusion. जो occlusion है उसकी intercuspation the result of muscle forces acting through intercuspation of the occlusion. तो basically question is very twisted. I don't know what they're trying to ask, but result of for muscle forces acting through intercuspation. तो बेसिकली जो डेंटेशन होता है इट इज अ न्यूट्रल पोजीशन, बैलेंस होता है टंग एंड मस्कुलर फोर्सेस का. तो देयर इज स्ट्रॉन्ग टेंडेंसी ऑफ द teeth to drift mesially even before they appear in the oral cavity, and this phenomena is known as mesial drift tendency. Mesial drift tendency. I'm really sorry. Very sorry. So I don't know what they're trying to ask. Mesial drift tendency तो दिया हुआ है answer in the explanation, but option में कुछ और ही दिया हुआ है. I have to ask this question, तो मैं लिख लेता हूँ कहीं पे. ठीक है. Closure is rapid following loss of which primary. Okay. तो अगर आर्च है, मोस्टली हम कौन सा टूथ लूज करते हैं? मैक्सिलरी मोलर्स ना, तो अगर maxillary molars closing within the 6 months, for example, in case where a proximal loss of tooth structure due to caries or even loss of tooth as a whole occurs, the mesial component of force is unstopped and may cause mesial drifting, obviously, and there'll be mesial drifting. It may cause mesial, and this tendency of mesial drift is more pronounced in the maxillary posterior region, more so during the eruption of the first permanent molar. If space closure occurs, it usually takes place during the first 6 months after extraction. So this is true, like first 6 months में ना ज़्यादा होता है, ज़्यादा tendency to invade the space वो ज़्यादा होता है during the first few months. And space closure when it occurs is more rapid with loss of the second deciduous molar than with the first deciduous molar is lost. And the amount of space closure is greater in the maxilla than in the mandible. Because space ज़्यादा मतलब it's more like jaw बड़ा होता है ना इसलिए more rounded होता है ना, that's why space closure is more वहाँ पे. तो okay, 8-year-old child has a first molar cusp to cusp relation. तो ट्रीटमेंट कुछ नहीं करना होता, उनको बस देखना होता है, recall and observe. Which of the following serves as a safety valve? तो safety valve जो होता है ये तो हमें पता है, max canine, maxillary intercanine distance, canine width, safety valve mechanism, तो यही इनका ही काम है. For remodeling of the palatal vault, as it is being translated, the bone is removed. जो palatal vault होता है उसका remodeling हमें करना है, and or it's being translated like it's being moved, the bone is removed. So from the knees, from the floor of the nose that to the roof of the mouth. तो क्या कर रहे हैं ना हम, palate है, this is palate vault है, we have to translate it, कुछ defect होगा, we have to move it. तो हमें nasal जो floor होता है, जो nasal floor है उसको वहाँ से तोड़ के यहाँ पे लेके आना है, ठीक है, from the floor of the nose and add it to the roof of the mouth. Now remodeling हम ऐसे ही करते हैं ना, remodeling of the palatal vault, which is also the floor of the nose and roof of the oral cavity, occurs by the bone is removed from the floor of the nose and added on the roof of the mouth. As a result, vertical एक तो height increase हो जाएगी of the body, and it will increase the maxilla translation in the same direction, क्योंकि वो भी downward and forward आ रहा है, उसका भी downward and forward direction में हो रहा है. And also noting the V principle of the growth is seen in the palate. तो यहाँ पे एडिशन होगा और यहाँ पे एडिशन होगा, यहाँ पे सब्सट्रैक्शन होगा और यहाँ पे जो भी है, मतलब इनर साइड एडिशन होगा, आउटर साइड सब्सट्रैक्शन होगा. V प्रिंसिपल उसमें तो यही होता है, right? These are very twisted questions, man. Epigenetic factor controlling the growth of the skeleton are genetic factor present outside the skeleton. Epi means outside the skeleton, or obviously genetic is genetic factors only. According to the counterpart principle, which of the following is a counterpart of the anterior cranial base nasomaxillary complex? Counterpart principle. So what is counterpart principle? We have to know this. Counterpart principle क्या है? तो क्या हो रहा है ना कि क्रेनियोफेशियल ग्रोथ हो रहा है. तो counterpart principle of the craniofacial growth states that the growth of certain skeletal parts, that the growth of certain skeletal parts of the craniofacial region are related specifically to other structural and geometric counterparts in the face and the cranium. तो ramus maxillary arch length और इससे तो definitely nasomaxillary complex तो बोल रहे जैसे अपना skull होता है. ठीक है, ये अपना nose है, socket है, frontal zygomatic bone है, यहाँ से arch निकल रही है to the ये अपना tympanic है, and we have mandible here, we have maxilla here, दांत है हमारे. तो ये बोल रहा है कि जो ये जो हमारा anterior cranial base है, तो ये look how close it is, nasomaxillary complex से ही तो counterpart होगा ना इसका. तो that is there. Bone remodeling ब्राश ने दी थी. Clockwise rotation refers to mandibular rotation, which is clockwise होगा ना ये तो downward, and also यहाँ से posteriorly. Negative growth is character thymus, scamons of falsus, genital tissue. Most of the growth is completed by the age of नहीं puberty में start होती है. What is canary system? Canary system क्या है? Canary system it is actually low powered laser that detects low power laser होता है lasering but low powered है. Detects caries not yet discernible on x-rays. तो x-ray पे जो नहीं मिलता है, x-rays can't find, वो canary system can find out decay, crack, defects and all. ये find out करता है. Decay, crack, defect by examining and measuring crystal structure breakdown. crystal structure breakdown को देखता है. And as small as like 50 microns up to like 5 तक detect कर लेता है. And also like below the tooth surface, जो surface है उसकी below इतना and इतना, like 50 micron to 5 below the surface. Below the surface it can detect. तो also जो canary system होता है ना, it has like audible and visual feedback होता है, feedback देता है, that engages the patient. So I have not seen canary system. I have not even used canary system, but it looks cool. The system looks cool. It has audio visual to engage the patients. Low power laser X-ray भी नहीं detect कर पाता, वो detect करता है. ये cracks and defect भी detect कर लेता है. ये क्या find out करता है? Actually crystal structure breakdown होता है ना, उसको find out करता है. उसको measure करता है और it it can measure up to like 50 microns to 5 below the surface of the sound enamel. So it's that efficient. Canary system. Now, criterion for severe early childhood caries. Early childhood caries. तो क्या होता है ना, it has criteria. Any sign of, अगर स्मूथ सरफेस पे है, स्मूथ सरफेस आ गया मतलब सिवियर है. Also less than 3 years. Any smooth surface or anteposterior deciduous that is decayed, missing, or filled in children with 3. स्मूथ सरफेस तो है ही, of anterior posterior deciduous, but deciduous obviously that is decayed, even if it's missing. अगर missing भी और filled, अगर ये भी है ना, filled और missing भी है between 3 to 5 years, तब भी severe अर्ली चाइल्डहुड केरीज में काउंट करेंगे. अगर डिकेड में अगर डीएमएफ है more than or equal to 4 at 3 years and 3 और अगर 5 है at 4 and 6 at 5 years. एक ज़्यादा मतलब डीएमएफ अगर इतना है, DMF is more than or equal to 4 at 3 years, more than equal to 5 years at 4 years, and more than or equal to 6 at 5 years. तो सिवियर में हम काउंट करेंगे इसको. Now keystone for caries diagnosis and risk is shown. कुछ तो डायग्राम है इस क्वेश्चन में. They've asked the patient level caries risk and likelihood matrix. तो keystones are there. caries staging है, पहले तो staging करेंगे obviously, then we'll assess and lesion activity देखेंगे, then we'll assess the patient's caries risk status, and then keystone 3 is synthesis and diagnosis. Staged caries lesion and severity and activity matrix lesion level पे. Now keystone 4 is comprehensive caries care plan. तो if there is likelihood of new caries formation तो keystone 4 पे आ जाता है. And caries lesion and caries activity status by the tooth surface. The surface में कुछ है like pit and fission all. तो new caries में there could be low, moderate or high. मैनेजमेंट करेंगे obviously. Inactive caries lesion है, एक्टिव है अगर इनिशियली तो नॉन ऑपरेटिव ट्रीटमेंट कर सकता है. एक्टिव इनिशियल है स्टेज पे. अगर एक्टिव मॉडरेट है तो वी कैन डू द सेम थिंग. मॉडरेट अगर है तो वी कैन कंट्रोल. एक्सटेंसिव है ऑल्दो so we can there could be preserving operative treatment of lesions. एंड रिकॉल वगैरह करेंगे हम, दैट इज कीस्टोन 5. तो पेशेंट लेवल में देयर आर 5 कीस्टोन्स. ठीक है, तो कीस्टोन फॉर केरीज डायग्नोसिस एंड रिस्क इज शोन वाज गिवन बाय. तो कीस्टोन ऑफ द किसने दिए थे कीस्टोन्स ऑफ केरीज डायग्नोसिस. और ये कीस्टोन्स हैं क्या, we have to find out that. Oh god, yeah. कीस्टोन्स हैं क्या, तो ये 5 कीस्टोन्स हैं बेसिकली. फर्स्ट कीस्टोन इज केरीज स्टेजिंग. स्टेज करेंगे हम. एनलीशन एक्टिविटी ये हम फाइंड आउट करेंगे. मैं सी कितना टाइम हो गया, 24. ओके, नाउ कीस्टोन 2 is to assessment of patient, Katie's risk status. Now keystone लिख क्यों नहीं खराब हो रहा है synthesis and diagnosis. Keystone 4 diagnosis तक तो keystone 3 में ही हो गया. Comprehensive Katie's care plan. And keystone 5 is actually outcome. क्या है outcome, क्या है recall करना है, क्या करना है वो. तो it was actually given by International Katie's Classification and Management System. International Katie's Classification and Management System, ICCMS. Now they've asked what nitinol can be used for. Nitinol तो हमें पता ही है, night eye wire, initial alignment के लिए यूज कर सकते हैं, leveling, retraction coil springs, ठीक है उसके लिए भी यूज कर सकते हैं, initial alignment, retraction coil spring, distalization of the molars as well, because इसमें ना shape memory होता है, shape memory, so that's why हम कर सकते हैं इसको. And it's also known as smart wire because it comes back to its original shape. Okay, तो इसको smart wire बोलते हैं, that's why. अभी के लिए इतना ही because 25 minutes हो रहे हैं. 27. एक और question देख लेते हैं. तो इसमें पूछा है most of the craniofacial जो structure facial skeletal structures है, they depict the V principle of growth factor, every mandible, maxilla and all. What is the exception to zygoma would be? Zygoma would be an exception. Coronoid also, palatal also. Then Meckel's ये पूछा है, Meckel's cartilage कब disappear होता है? It disappears to 24th week आयु में disappear हो जाते हैं. We have time. Which of the following is mechanism of mandibular जो growth होती है, mandibular growth, that is by endochondral ossification भी होता है उसमें. The surface remodeling also and primary and secondary displacement, it uses everything. Shorter upper lip होगा तो breathing is anatomy, mouth breathing होगा. 4S of correction of 4S. 4S हम कहाँ यूज करते हैं? 4S is spot, salivate, squeeze and swallow. तो हम ये टंग थ्रस्ट में यूज करते हैं, टंग थ्रस्ट में, क्योंकि 4S will remind the individual about the position of the tongue, तो where it has to be kept during the swallowing process. So this has 4 stages, no? Spot करेंगे, spot stage, then salivate stage, saliva आएगा, and we'll squeeze, we squeeze the tongue ना to the upper palate and then we swallow. तो tongue thrust का जो habit है that will be corrected 4S use करके. Do we have time? No, we don't.